Good evening, everyone. Welcome to the final episode of the Apex of Training and Development Cancer Awareness Program. I'm your host, Charian Hudge. This evening, we have a very diverse panel joining us to discuss cancer. We will be having Dr. Don Major, all the way from the Bahamas, and dietitian Miss Samantha Moit from the beautiful island of Antigua. And all the way south from Trinidad, we have Mrs. Gemma Zamor. Welcome, welcome, welcome. Tonight promises to be an insightful, invigorating, and intellectually stimulating session. Before we begin, I would like to shout out our sponsors, Nagico Insurance. This program would not have been possible without them. They are located as far north as the Bahamas, and we have a Bahamian representing tonight, and as far south as the ABC Islands, Aruba, Bonaire, and Curacao. For more information on Nagico Insurances, you can visit their website at www.nagico.com. So tonight we're going to begin this evening session. Those of you who are joining us via any of our social media handles, Facebook, YouTube, Twitter, remember to share the live, remember to invite a family member, invite a friend, let them know that the Apex of Training and Development is having its final episode of the Cancer Awareness Program. So we want to say good evening to our special guest, Miss Roberta Ephraim. Good evening, everyone. Looking forward to another informative program. Good evening, Roberta. Remember to share the live with your friends. Now we're going to begin with Gemma. She is a cancer survivor. Gemma, tell us about your story. What was your life like before you were diagnosed with cancer, and how has the cancer diagnosis changed your life?
Okay. Well, first of all, I started having lumpectomies at the age of 43 and 48. I had two lumpectomies removed. And I was fine for many years. And in 2017, I started having some back pain. And I was referred to the orthopedic surgeon. But as he questioned me, took a history, he found that I had a discharge from my breast. So he to and he also referred, they sent me for a mammogram, followed by an ultrasound. And there was nothing conclusive about them. For the back pain, I had x-rays and I was given physiotherapy. But somehow, although I was being seen at the clinic and I was having repeated mammograms and ultrasounds, but with no positive results of cancer. But in your spirit, you tend to know, look, something may not be too right. So I met Imelda at the HCF conference in Trinidad in 2018, about the October month 2018. And she shared her story. And I decided, look, Gemma, you get a second opinion of what you have been experiencing. And I spoke to a friend who, introduced me to a doctor at the Women's Health Clinic at St. James Medical Center, where we also treat the cancer patients. And the very first day I went to clinic, that doctor decided to do a needle biopsy on both of my breasts. And she told me, we will have to wait on the results, but as soon as it comes back, we will decide what to do, where to go from there. And truth to her word, when the results came back and I went back to the clinic, there was the results, cancer of both breasts. The right breast, the cancer was in situ, but the left breast, the cancer was invasive. Of course, I was not really shocked, but a little perturbed because I said, my God, for 2 years, I have been visiting Port of Spain hospital and having, so many mammograms and CAT scan and nothing showed, but they had never done a biopsy. So the doctor at St. James Women's Clinic, she decided, look, Gemma, we will have to go in. So she consulted with another surgeon, and together they decided that as soon as the operating theater was available, they were going to do the surgery. So I had the surgery done on the 8th of August, 2019. Because this was 2 years after I had it done in Port of Spain. So in 2019, I had my surgery. And the results from the surgery, they said that I was stage 2 and I was triple negative. Now, although I'm a nurse at that, I was working at that time, I really did not understand everything that was happening. But I spoke to God because I knew that my only help was from Him, in spite of whoever was going to be part of my treatment. God was foremost. So I started, talking to my God, and I told Him, look, you have to take over because I have no one else whom I can trust. I was sent to the oncology consultant and with my daughter, and he advised us that I would have to have 4 cycles of chemotherapy. And because of the type of cancer I had, I would not be able to have any further hormonal therapy. If I needed anything further, it would have to be just radiation. He said it was a good thing, but yet still it was a bad thing. But I trusted God wholeheartedly for the best outcome of my situation. I wasn't frightened because I know who had me in His hands. I was sure God, who had kept me throughout all the seasons, He was able to keep me even in this. So I trusted Him. I went through treatment. It wasn't too bad until the last cycle. When I vomited, I was sick. My daughter even said, Mom, you were delusional. You started talking to your husband who had died some years ago. I can't remember that. But
Okay, I'm going to ask
that
you
last,
to stick a pin
yes,
there. I'm going to get back to
yes,
your side effects. I'm going to bring in Dr. Major in the
okay.
conversation. Dr. Major, she mentioned something about her breast being triple negative. Before we begin to ask questions as it relates to the different cancers you would have operated on, what exactly is she referring to when she speaks of the results being triple negative?
Yeah, so good night, everybody.
Good
When we
night.
talk about triple negative, it's basically the hormonal receptors on the breast cancer. So when we send off a breast biopsy, whether it's a needle biopsy or an excisional biopsy where we actually remove the lump, or even if we remove the entire breast, however we send that breast specimen, they also send it for hormonal markers where they look at estrogen receptors, progesterone receptors, and the final one called HER2/neu. And ideally, you would like to have a tumor, if God forbid you get a tumor. Ideally, you'd like it to have estrogen and receptor positivity. And that way, at the end of the day, you can get hormonal tablets, usually for about 5 years afterwards, to minimize recurrence. But when you have triple negative disease, meaning that their hormonal receptors are negative, so estrogen receptor negative, progesterone receptor negative, and HER2/neu negative, that means they can't give you any additional therapy outside of chemotherapy plus or minus radiation. And those tumors, they tend to be a little more aggressive than the ER, PR, or the hormonal positive tumors. So those ones, we tend to be really aggressive with our treatment.
Okay, Dr. Major, what are some of the risk factors that could cause breast cancer in particular, apart from genetics?
Well, the main risk factor is that of being a woman, because I tell most of my patients that 1 in 8 women will get breast cancer, when it compares to almost 1 in 800 men that get breast cancer. So men get it too, but on a much rarer occasion. And some of the risk factors that we know about are that of obesity. So being overweight or obese increases your risk of developing many types of cancer, including breast cancer. There's also the risk of prolonged estrogen exposure, meaning that if you saw your man, or if you started seeing your periods at a very young age, say under 13, and you see them up to a very late age, over 50 or 60, that means that you've had a very long period of which you were exposed to estrogen. Things such as oral contraceptive pills, if you're taking them that have estrogen for a prolonged period, they also can increase your risk. Other things such as not having any children, because again, the pregnancy cycle breaks that estrogen exposure. So if you don't have children, you also at an increased risk for developing breast cancer. And then the other ones, such as drinking and smoking, also increases your risk. And like you said, depending on your genetics, you may also be at an increased risk for developing breast cancer. And final one is if you have family members, so you have multiple relatives in your family with a history of breast cancer, your risk is also increased.
What about being exposed to radiation? Someone working in an airport environment that have to go through the screening process at the airport, or even passengers that travel regularly, are they at risk of developing breast cancer? Because I know sometimes they normally use the one to pat you down. How risky is that?
It's not. Well, it's not in the literature with respect to increasing your risk for breast cancer. So I wouldn't say radiation per se at those levels increase your risk of developing breast cancer. Now, if you've been exposed to high doses of radiation, whether it's been like treatment for something. So let's say you had some kind of, as a child, had some kind of mantle lymphoma and they had given you high doses of radiation to the chest area, then you may be at an increased risk for developing breast cancer. But when we talk about those low dose radiation, no, there's no real increased risk.
To Major, we're going to invite Miss Samantha Moit, a dietitian who resides in Antigua. I'm so happy to have a dietitian because I've been looking for one to participate in this program forever. So thank you so much for being a part of our program. Before I begin to ask you questions, is there a difference between a dietitian and a nutritionist?
Good evening, everyone, and thank you so much for the invite this evening. I get that question a lot. Yes, there's a difference between the dietitian and the nutritionist, and it all has to do with the education. A dietitian goes, we all start with the same basic degree, but a dietitian goes a bit further and does an internship where he or she has to complete several hours of rotation, both inpatient, outpatient, and then after that, complete a board exam. So that would be the difference.
Okay, and what should a cancer patient diet look like?
So there isn't any one diet for a cancer patient. what we usually recommend to start with is that they're eating generally foods from the different food groups, all right? Because once a cancer patient starts treatment, they want to be, at the healthiest point, and I say that quote unquote ever, when it comes to their nutrition, because you never know what will happen during treatment in terms of how well they will tolerate it, or if they're going to have any side effects that's going to affect their eating. So going in and working with cancer patients in the past, I always tell them, eat up. So getting the foods from the different food groups. There isn't any one food that boosts your immune system, but there's certain foods that are very important. One of the first ones are protein. So foods that contain protein, whether it's lean meats, your peas and beans, your nuts, any of those types of foods are good because those are what your body uses to repair and for recovery. So that is very helpful. The other important food group is your carbohydrates or your starchy foods, like your provision, your rice, your oats, those sort of things. Those are your energy foods. That's where you're going to get your energy from. Of course, you have your peas and beans and nuts, seeds as well. In that group, you have the healthy fat and also quite a bit of fiber, which tends to be filling. Though that particular food group is also important. Fruits and vegetables, yes, very important as well. But the important thing to note is that not to depend on one single food group. It isn't a cure-all. What works well is if you have a variety of whatever foods that you can tolerate.
All
And
right.
one last thing I wanted to mention, water. Making sure that you're well hydrated. For everybody, how much water you take in may be a little different, but getting in enough water throughout the day is very important as well.
All right. I often hear persons speak about antioxidant. Does that help to fight against the multiplication of cancer cells? Is that something that a cancer patient should have in their diet?
Right. So at this point in the diet, I should make it clear. So yes, antioxidants are cancer fighting foods. So it's cancer fighting if it's mostly used before, let's say, for instance, a person is diagnosed. Not to say that there isn't any effect when a person is already diagnosed, but most of the effect is before. So that's why in general, in nutrition, we always encourage using your antioxidants, your phytochemicals, which are found in fruits and vegetables. It's found in your probiotics like yogurt and so on. So in many different foods. As I said earlier, there isn't any one food that's going to help or cure. It's mostly a variety, but getting those foods in and them working all together, it's what's going to help.
All right. Thank you so much. Dr. Major, we're going to go back to you. You are a surgical oncologist. Um, After a female does her breast surgery, what are some of the things she should be doing? Should she begin to do physical therapy right after? How many weeks after should she begin physical therapy or any form of exercise after a surgery?
It's a great question. So it all depends on the type of breast surgery in which she's had. So if she's had something such as a lumpectomy, which is where you just remove the cancerous lesion and send it off to the lab, which is usually just a day procedure, pretty quick, minimal pain afterwards. These individuals can return back to normal activity within a week. Compared to somebody who has had maybe a mastectomy, which we remove the entire breast tissue, plus or minus testing the lymph nodes under the arm, these individuals, they may need a bit longer time for recovery prior to starting some physiotherapy. And usually for these individuals, it takes anywhere from about 2 to 4 weeks to kind of start to feel back to normal. Usually we start physiotherapy, and it's mostly for when we operate underneath the armpit to take out the lymph nodes. So sometimes in advanced cases, and you have big bulky lymph nodes under the arm where the cancer is spread, we have to remove those lymph nodes in a surgery which is known as an axillary dissection. And for those individuals, they can have some shoulder stiffness afterwards. They may have some numbness underneath the arm. They can get quite a bit of discomfort and pain in that shoulder. So for those individuals, we like for them to start physiotherapy relatively early, within the first week or two. And certain things that we let them know that they can do at home. So you don't just want to keep the shoulder by your side. We want you to, on a day-to-day basis, just kind of walk it up the wall, see how high you can get up. You can also do things such as, combing your hair with that shoulder or with that arm, and try not to avoid using it, because some people, once they have some pain, they would tend to favor the opposite side that's not causing them any issues, and try and rest that side. But for the shoulder, that's not a good idea. But those are the main physiotherapy things that we ask for individuals to do with respect to breast surgery. Because the breast itself, you don't really necessarily need any physio for that. You can, like I say, within a week to 2 weeks, if it's a small surgery, or up to 3 weeks, you'll be kind of back to normal.
All right. Thank you, Dr. Major. Just to read a few comments coming in. Those of you who are joining us, feel free to ask our panelists any question you would like to know, and remember to share the live. Remember to tell a family member and a friend that we are live here on the Apex of Training and Development. Good evening, Lily, from the beautiful island of Antigua. We have Sarah Lee James. Good evening, everyone. And we have Bernadette Joseph Ephraim. A blessed good evening, everyone. I hope all is well. Good evening. Good evening. Good evening. Good evening. We also have Falsam Graham. Good evening. And we have we have a question here. We have several questions actually. What foods should a cancer patient avoid? I believe this question is for our dietitian. What foods should our cancer patients avoid? And then after the dietitian comments, Dr. Major, I don't know if you'd want to weigh in after she comments on this question.
All right, thank you for that question. I think another question I saw right before that was, what food should a cancer patient eat? So I'll try to knock both out. So when someone is diagnosed with cancer, it doesn't mean the end all for certain foods. We do know that there are certain foods and nutrients that not necessarily making the cancer worse, but it makes your health worse. And because you're already in a vulnerable position with a diagnosis of cancer, we don't want to worsen any other conditions. So say, for instance, things like salt, salty foods, processed foods. And when we say processed, a lot of persons always think, well, just your canned foods. But it's not all canned foods are as, processed as some. So that's something to bear in mind. The other group to be careful of are cured meats. A lot of red meats. Is actually recommended that persons try to eat what we call more plant-based. So more beans, more peas, provision, those types of foods. And as I said, the protein is important, so they'll be getting the protein from there. Not that you can't use other meat, but try to keep especially red meat and cured meat, like your pickled meat, to a minimum. With regards to sugar, just in general, with general diet, you don't want to be over consuming sugar or fat for various reasons. I know there's a myth about sugar making the cancer worse or causing, the cells to replicate more, and we don't really have enough evidence to prove that. But we do know that sugar is empty calories. And when you're having loads of sugar, you're missing other important nutrients that you may be needing, let's say, for instance, from your fruits and vegetables. So it's important to think of that as well. The other important thing is to make sure that you, as I said, eat a variety of fruits and vegetables, and don't be afraid to try new foods. Sometimes, depending on what stage you are in your treatment, you may find that the foods that you normally tolerated well before, you don't tolerate well now. So that's why I can't give a general guidance, say, well, eat chicken and rice, because everybody's not going to tolerate that. So you have to find what you tolerate. Sometimes I may have to tell a cancer patient, hey, you probably may need to eat some ice cream, because let's say, for instance, they're not eating well, which is usually an issue. You find the weight going down. With the weight going down, that creates more issues, increased risk of other illnesses, and so on. So it's important that snacks, if you can't eat large meals, making sure that you have frequent snacks that have an appropriate amounts of protein and calories. So things like small sandwiches. So if you're using like tuna fish or turkey or even cheese, depending on what type of cheese you're using, yogurts are good because they also contain the protein. Peanut butter or nut butters in general, that's another good source of protein that you can have like with crackers or with bread if you feel that you need the extra calories. Cereal with milk, whether low fat or plant-based milk, that's fine as well. It's also important, when you can eat a heavy meal, eat a heavy meal. Sometimes you don't feel like eating a heavy meal all the time, breakfast, lunch, and dinner. But if you find breakfast is best for you, where you can tolerate a heavier meal, go all out there and have it at that time. And then throughout the day, you can do smaller snacks.
Would you like to weigh in on Miss Moit's comment as it relates to food that should not be consumed based on your experience, what you would have seen?
Well, I agree wholeheartedly with Miss Moit. Again, it depends, like she said earlier, on the stage of your tumor. And let's say when I deal with pancreas cancer patients, and let's say we've done a major operation on them and they are in the recovery phase and they're not eating as much and they're losing weight. And this is where, like Ms. Moit said, we would recommend things such as ice cream or smoothies or milkshakes for them to try and boost their caloric intake. But that's not for everybody. I recently, I would say probably about a year or two ago, watched a video on Netflix. I think it's called Beyond the Meat, and they were showing all the benefits of a vegan diet. And I think there is something there. But with respect to the exact etiology or the exact mechanism behind it, not entirely sure. But I think that a vegan diet, along with exercise, is always important to add exercise into your daily living, to minimize the chance of you developing any of these what we call chronic non-communicable diseases. So exercise, healthy diet, all these things can lead towards you having a better life.
All right, before we ask some of the questions that are coming in to the panelists, I'm going to invite Mrs. Zamora, to tell us about some of the side effects she experienced after her chemotherapy or her treatment.
Okay. Well, for me, during the treatment, I experienced a lot of nausea and the last treatment. The first treatments weren't too bad, but that last treatment, I had vomiting. I thought I was never going to stop vomiting. It was really, really bad. But I was given treatment for the vomiting, so I took it, and it really helped me. I also went on more liquid diets like soups and smoothies, because on many days the heavy foods I wouldn't tolerate it. And I didn't have the taste in my mouth for food. So my daughter would prepare the smoothie and the soups and even mash some of the foods like the potato and green fig or provision, and that will go down. But and besides that, I started getting some numbness in my feet, which was strange. I was saying, you're getting one sort of treatment, but here's your feet. And I want to say that a funny feeling in my feet at times, even my big toe still feels, no, normal. That it's not normal. It has never come back to normal feeling. And but I must say, thank God, I didn't have any, except the day when my daughter said I was delusional. I didn't. Oh, of course, I had the hair loss. I had that, but other than that, I have been pretty good. God has been good.
Amen. To God be the glory. I love when cancer survivors share their faith and how God has really kept them throughout their journey. Amen. Thank you so much.
Yes.
We have a few comments coming in from Siobhan Stevens. Good evening to the panel. Good evening, Siobhan, all the way from Canada. Thank you so much for joining us. We have a question from Sarah Lee James, and I believe it is for either the dietitian or Dr. Major. Should survivors avoid consumption of sugar?
All right. So that's a very common question about sugar. So the important thing to remember is that sugar comes from different sources. And if persons, so the source, the fructose source, where we find like in your fruits, your bananas, your fresh juices, and so on, those are fine. Those are fine to continue to use on a regular basis. However, just in general, and this is beyond cancer or any other just general life healthy recommendation, sugar intake should be limited, because sugar is very high in calories, and it's easy to consume quite a bit of it in a short space of time, and doesn't do much for you except for things that you don't want it to do, including increasing your weight. For persons who especially are at risk for diabetes, it can take them over that threshold if they're there already. Now, do you have to absolutely avoid sugar? No, it's still okay if you had a little piece of cake now and then, but moderation is key. Definitely not something that you would overdo on, because it's of the calorie content. And as I said, sugar by itself, meaning like this includes white sugar, brown sugar, honey, simple sugars. Your body processes it very quickly, and it causes fluctuations in your body's use of insulin and so on. So I would just suggest just on a regular basis that you don't overconsume it.
All right, thank you so much. We're going to go back to Gemma because she spoke a lot about her faith and how God has really helped her to go through her journey. What are some of the other coping mechanisms you would have used to help you through your journey as a cancer survivor?
Well, first of all, I'm retired, so I just kept myself busy, sharing the word of God. I have been involved in Bible study, prayers. I am also have been encouraged to support anyone that the Lord would lay on my pathway. I would make sure I'd be there for people. And so far, I am involved in Hospital Christian Fellowship. So I keep those appointments. Of course, again, it's mostly Christian based. But I must say, during my recovery, I started a herbal garden. And, the therapy in that was really beautiful. I was able to be outside and, attending the plants and things like that. And it helped, it helped. The way I live, it's not so easy to, go in a savannah or so, but I would walk around the house. I make sure that I would walk and, I have been able to keep myself busy, doing whatever I have to do to, but mostly, as I say, it's Christian based or to be supportive to any individual God would send my way. And, sharing is so important. So a lot of people tend to feel, oh God, they have cancer. And so, and I hear people talk about that. You have a death sentence, so what? I know that life is not forever. But whilst I am alive, I will do whatever God would have me to do. Wherever He will direct me, I am prepared for that. So I do not sit down and mope and wonder, oh God, when death will come. No, I'm not that. God has really allowed me to be very positive because I know that, I'm prepared for whatever eventuality will come my way. But whatever I can do whilst I'm alive, I try to encourage. I had a friend, a colleague who had the same problem like me. And she was the one who helped me to understand a lot of what was happening, if not simple thing like, to lie down on my left side, because I had the lymph nodes, 13 lymph nodes removed. And it was a difficult time as to how you have to position yourself, to sleep. And she told me to get a simple thing like a cushion and put it on the side under the arm. And I was able to, sleep and be comfortable. That, so I think we need to be able to share with others. Don't feel embarrassed. I have a sister-in-law who was my full support during my treatment. And I thought she understood everything that I was going through. Don't take anything for granted. She was diagnosed with cancer in January and she died in July. So, just talk. She never even told me she was going through anything. We need to be able to be open and share what we are experiencing. It's nothing to hide and to feel ashamed about. Sickness comes to all. But we know that when we trust God, I cannot help but talk about how much I have trusted God. Because throughout my life, I have had many incidents of sickness because I am diabetic and hypertensive. I had total thyroidectomy. As I said, I had 2 lumpectomies during my period, but I always trust God to do what He has to do for me. And I was never ashamed to ask for advice from, I'm not going to effie on anybody, but people who I think they were able to help me, I would surely ask them. And I had some really good friends who supported me, tell me when to, take the um, probiotics, how to watch my diet. You know, I went on keto diet, not a full keto diet, but I went on a keto diet. So I stopped eating too much white rice and bread and things like that. But um, protein, high protein, high fiber diet. And and this was advice. So when I heard the nutritionist, the dietitian talk, I say, yes, I have been very obedient in doing those things. Even my doctor, the oncologist, he told me, my daughter and myself, when we went, but he gave us some counseling to make sure and have a lot of fruit, lots of water. And I have been, doing these things. I even take a few supplements on the advice of a private doctor. Make sure my immune system is up. And I have been really following the advice.
Wow, thank you so much. Before we have a lot of questions coming in, but before I move over to those questions, I would like to share a tumor that was removed from a cancer patient by Dr. Major. And Dr. Major, I would like to find out from you what would be some of the causes of this type of tumor. It's a colon, the person was diagnosed with colon cancer, I think. You can correct me, Dr.
Yes.
Major. So, bear with me.
Yeah, you can hear me?
Yes, I can. All right. So this, I'm looking at your information here, and it's saying another large tumor removed, this time from involving an individual's colon. Dr. Major, what could cause something like that or this to be in somebody's body?
Well, colon cancer usually starts from a normal colon. And for a normal colon to go to a cancerous lesion usually takes about 10 years. So it's recommended that individuals over the age of 40 get a screening colonoscopy at the age of 45 just to make sure that they don't have any of these polyps lurking and they can be removed with the colonoscopy. But if you don't get your colonoscopy and you just basically continue on with life like everything's okay, sometimes you can have one of these polyps that progresses into a tumor within the colon. Now, some people, when they get these lesions, they may not have any symptomatology at all. So it depends on what part of the colon is involved. If it's involved in the left side of the colon, some individuals may get some constipation. They may also have a bit of bleeding. They may also have a bit of bloating. But many people, they don't like to visit doctors, so they just chalk it up to bad eating habits, or it may be just gas and nothing's really wrong, and they just continue going on. I suspect this individual may have been having symptoms for quite some time prior to them coming to the hospital and seeking medical attention, because it was a pretty large tumor involving the colon, and we were able to get it out quite safely, and we were able to put her back together. But something like this, you would know that something just isn't right. You have, like I said, constipation, a bit of bleeding. You may feel some vague discomfort in the upper abdomen. But I always tell people that it is important to go and get your body checked on a regular basis. So seeing a family doctor every 6 months or once a year, just to make sure that things are in order. It's like having a car. You don't drive your car every day without checking it every 3 to 6 months and getting it serviced. So why do the same with your body, Because these things, they can be picked up at an earlier rate, and you wouldn't necessarily have to go through such an extensive procedure. If this was picked up earlier at a colonoscopy, a screening colonoscopy, you could have taken it out via the colonoscopy, and this patient may have never have to come to an operation.
But does this mean that this patient has cancer, or the patient just has a tumor?
No, this patient has cancer.
So did it spread to the organs?
Well, it didn't. It was pretty locally aggressive, but it didn't spread anywhere else, and we were able to get it out without spilling any of the tumor cells. But like I said, it did not spread. Normally, colon cancer tends to spread to the liver and to the lung. When we were in the inside, we didn't see any spread anywhere else. And she did have some imaging prior. She had a CT scan that didn't show any evidence of disease anywhere else in the body. So it was just at this area. And technically, once we send that to the lab, they process it. They let us know what type of cancer, where exactly it is, and whether or not there are lymph nodes involved, so we can get a better idea of staging of this cancer.
Okay, so this is quite interesting. So, what can be done to prevent this from happening? And I noticed you said it's recommended that, if I'm not mistaken, you do a colonoscopy at the age of 45. What if you? I've had friends in their early 30s that have been diagnosed with colon cancer. Why isn't it recommended to do a colonoscopy in your 30s or 20s?
Because it's not that common to get individuals under the age of 45 with colon cancer. We do see it, mind you. So I may say it's probably like around 1 to 2% of the cases. The majority of people that have colon cancer are over the age of 45. And that is kind of the recommended age by the American Society of Cancer and the U.S. Preventive Task Force, that at the age of 45, you go ahead and you get this colonoscopy. Now, saying that and saying that individuals under 45 get cancer, it's also important that, like I said, you see your family physician. And if you have any symptomatology, don't just necessarily brush it off as saying gas, because most people, especially here in the Bahamas, anything that's wrong with them, they chalk it up. They say, that's just gas. Let me drink some tea and I'll be okay. Right. But if it's going on for a period of time, then you should go and get assessed, because you never know. There may be something extra going on. I think the youngest person that I had found with cancer of the colon, I think she was at the age of 24. And when we found it, she had spread throughout the body. Now, she had a disease process called FAP, which is known as familial adenomatous polyposis syndrome. It's basically where her entire colon was carpeted with polyps. And that's a hereditary thing. So other members in your family may have FAP and they pass that down to you. And those individuals we treat differently with respect to screening as compared to the average risk person, where we tell them to screen at 45. If you suspect that you have FAP, you may start colonoscopies as early as the age of 10. So it all depends on what your historical background is and your genetic background, where we kind of decide what is what with respect to screening and management. But usually those individuals who have cancers at that very early age, they tend to have some kind of genetic predisposition, or they tend to have some kind of polyposis syndrome that put them at risk, which is rare, but it can happen.
All right. Thank you so much, Dr. Major. There are a few other images I would like to share and I would like you to explain, but we're going to get into our questions because we have a lot of questions that we need to respond to from our viewers. We have a question: should seafoods be consumed less? I believe this is for our dietitian.
Yes, I did see that question. Should seafoods be consumed less? Now, it depends. One of the things, especially for cancer patients going through treatment, their defense system isn't as strong as if they were not going through treatment. So, regardless if it's seafood, eggs, meat, any types of foods that are being prepared, it's important that they are prepared well or fully cooked. So things like sushi and so on is not recommended if you're thinking about that type of seafood or on the cook shellfish or anything like that. Nothing on the cooked. Once it's cooked fully, it can be consumed. Within that same breath, though, it is important that, especially if you're going through treatment, that you're not eating out from different households, places, anything like that. And the reason is that, foodborne illnesses where it may not affect other persons, it may affect you. So it's important that you try to get someone that you trust and you know that is quite hygienic to prepare your meals for you. Avoid cross contamination. So if you're cutting up chicken or cutting up fish, you're not using the same cutting board or the same knife to do your vegetables. Because, as I said, the risk is higher. Making sure that your vegetables and fruits are washed properly. If you're using canned foods, you wash off the can before you use the product. So though you have to take extra precaution, even the water that you drink, making sure that it is boiled, filtered, bottled water. And if you're buying drinks out, I'm not sure what it is in the other islands, but I know in Antigua, some persons sell what we call natural juices where they make from home and sell. If you're not sure of the source of the water, you want to be very careful. But these recommendations are if you're going through treatment and, your defense system isn't as strong as if you weren't.
All right, thank you. We have another question. I believe this question is for Dr. Major. Should survivors avoid using and being exposed to plastic products such as plate, cups, or does it depend on what stage the patient is?
I think the whole world is kind of going away from plastic, just basically because it's really not recyclable, and there's this huge landfill in the ocean of just plastic. So to say that it should be avoided, I think it's gonna be avoided regardless. Um, I would say that just generally it's not safe to kind of warm things in plastic containers. Um, eating with a plastic fork or eating out of plastic plate, I don't think that's going to add anything to your cancer risk or risk of, if you've already had cancer, risk of it coming back. But like I said before, the plastic thing will at some point become obsolete because they're trying to get rid of or minimize the usage of plastics just because of its effect on the environment.
All right, thank you so much. Good evening, Alma Brooks. Greetings, everyone locked in from Hawaii. Blessings and more blessings. Greetings, Jason Hudge. Thank you so much for joining us. We have another question here. Alma Brooks is saying, praise the living God. Hallelujah. We have a question from Jason Hudge, and it's, can the use of mushrooms help from cancer cells or prevent cancer cells from multiplying?
I thought you were going to give Doc that one, but that's okay.
I
I'll
think
take
that one
it.
is for you.
So I do not know the answer to that in terms of mushrooms helping um, cancer cells or preventing them from multiplying. What I can say though is that a plant-based diet in general tends to be helpful for in the prevention of cancer in the long term. Now, if you already have cancer, and I haven't seen any research supporting using extra mushrooms. But as I said in the beginning, you don't want to depend on any one food because where it may be, in small studies, maybe seemingly to do one thing, it means that you may, and it's the same thing for certain supplements. You can be getting in too much of the wrong types of things and missing out on other nutrients. So I would never go wholeheartedly and say, use more of this one food because it helps to decrease the multiplication of the cells. I know there's a lot of talk about out there about what foods are good for cancer and so on, but a lot of it isn't proven.
Right, we have a question. This one is via WhatsApp for Dr. Major. But before I move on to this question, we have a comment from Mr. Stevens. I find it's quite an interesting comment. We can trust in God and live healthy lifestyles simultaneously. Dr. Major, would you like to comment on this person's comment?
I think he's correct. We can trust in God as well as lead a healthy lifestyle. Because He has put these things here for us to partake. As much as the fruits and the vegetables, these are things that come from the earth, and they're here for us. Things such as exercising and not necessarily just eating a bag of potato chips and watching TV all day is not leading a healthy lifestyle. So I think we can trust in Him, believe in Him, as well as do our part to kind of take care of ourselves as well, and not just put it all in His hands, and do whatever it is that we want to do and feel that it'll be okay at the end of the day.
All right, that's an excellent response. We have a comment from Aurelia Casimir. You have great faith, Mrs. Zamore. Continue to share your story. God is faithful. Now, we have a question for Dr. Major. Can cancer develop its own blood supply, and can it be difficult to remove?
Well, that's how cancer kind of grows and spreads throughout the body, is that it does have a factor called angiogenesis. So it releases these hormones that produces new blood vessels that feed this cancerous tumor. And it kind of removes the nutrients that you need for your body and takes it for the cancer to kind of grow, and allows it to spread to other parts of the body. So yes, it does develop its own blood supply, and at times, depending on how advanced it is, it may not even be removable, like you're asking, because if it has spread throughout the body, let's say you had a breast cancer or a colon cancer that had moved from that had spread from the colon to the lung to the liver to the brain, then taking it out of the colon wouldn't make a difference, because that patient doesn't necessarily need surgery at that point in time. They would need palliative chemotherapy or even maybe radiation therapy. And then sometimes these tumors can be so extensive that they may involve major organs or major blood vessels that allow you that actually stop you from being able to remove it. Because if this tumor is invading into the main blood supply, let's say it's a colon cancer, if it's invading into the main blood supply of the small intestine and you have to come through that, you can't take that out, because you can't take the blood supply to the small intestine, because the entire small intestine dies. You won't be able to have any form of way of getting your nutrition in your body. So sometimes it depends on how aggressive or how advanced the tumor is that actually stops you from being able to remove it. And this is why screening is so important for most of these common cancers, such as breast cancer, colon cancer, prostate cancer, because you want to get these cancers before they get to that metastatic stage, or before they spread, or before they become locally aggressive where you can't take it out. You want to get them early where you can do smaller procedures to get rid of them. And you may not need chemotherapy or radiation therapy in the end if you can get them at an early stage.
Dr. Major, I think we have a question here for you from Falsum Graham. Can a person who is diagnosed with diverticulum develop colon or any other cancer?
So diverticulum, or diverticular disease, is basically outpouchings within the colon. And they tend to be a benign process. So they tend not to be cancerous. Right? And they happen in about 80% of the population if you live old enough, if you live long enough, because it's just basically the small, where the blood vessels come in to supply blood to the colon. You have the colon kind of pouches out there, and some of these can actually bleed, or some of them can get blocked with stool and cause inflammation. You may get pain. You may get pretty sick from it, but it's not necessarily a cause for cancer. Now, some individuals who present with cancer can present such as they have an acute inflammation of a diverticulum. And once that inflammation settles down, it's recommended that after about 6 weeks, you get a colonoscopy just to make sure that there isn't an underlying cancer that actually causes inflammation in the first place. And just to ensure that it was just truly diverticulum or diverticulitis.
All right, thank you so much, Dr. Major. Before we go back to Mrs. Samore, I have a question for Miss Miot. Okay, can it's recommended that we use supplements, dietary supplements in like on a regular basis. Can foods be used to replace dietary supplements?
A very good question, and it depends. So, if it's a nutrient that's found, well, in foods that you can easily access, that's fine. However, the way we always look at supplements is like an extra insurance, in that no, it's hard for the diet to be perfect where you're getting all the nutrients you need at the time that you need it. And that is why some supplements are important. So let's say, for instance, vitamin C. So vitamin C is an important nutrient, and a lot of persons do take vitamin C and eat vitamin C foods. However, it is a water soluble vitamin, so beyond the amount that your body needs, it doesn't store. It's what we call expensive urine, in that you would, pass it out. So it really depends on the supplement. What I would caution persons, though, is to make sure before taking any supplements, especially if you have cancer, to speak with your doctor first to make sure that, number one, it isn't interfering with any other treatment that you're getting. The other important thing is that you're not taking too many, because what I've seen in some clients is that they take many supplements. Oh, they hear this particular one is helpful in the reduction of the tumor or fighting the cancer. So they take multiple. And because you're taking multiple supplements, it makes it hard for them to eat regular food, which contains the actual nutrients that they do need. So we also want to be careful with over supplementing as well. But yes, supplements may be necessary in some cases, especially since most persons are not eating the required amount of nutrients daily.
And can supplements, if it's used alongside prescribed medication, be harmful? Because I could remember I've had experiences where I've been using both, and it made me feel extremely nauseous and sick. But I never really got an opportunity to ask my physician if it's a wise idea to use supplements alongside prescribed medication. Is this recommended?
That's a very good question. And that's what I said at the beginning, making sure that if you're taking up a supplement, let your doctor know, because that would be a discussion that you'd have to have with your doctor, and he or she would have to check to see if there's any interference. There's some supplements, unfortunately, that there's not a lot of information out there about it. So it's kind of hard to say yes or no that you can, and some persons try it. I even know of persons who would forfeit taking their regular medication because they're unsure and just take the supplements. But the first course of action is to speak to your physician first before you mix both, because you can be putting yourself in a tough spot.
Dr. Major, is something like this harmful? Mixing supplements with prescribed medication?
It can be, depending on which medication it is. And I think of sometimes individuals may be on blood thinners for whatever reason, and certain supplements could kind of worsen the effect of those blood thinners and actually cause you to bleed more. So, depending on what you're taking, it is imperative that you do speak with your primary physician who has placed you on these medications, and let them know that you've been taking whatever supplements it is. I just want to make sure that they don't interact with the medications that they've started you on, because there can be some interactions with these medications.
Thank you, Dr. Major. Gemma, I absolutely love your spirit, very positive energy, very vibrant lady. I mean, just listening to you, you're just a source of hope. Anyone listening to you would feel as though there is hope after being diagnosed with cancer. What sort of support did you receive? is there a cancer support community in Trinidad that you are a part of? Tell us about your support system.
Well, I'm not involved with any of the groups in Trinidad, the Cancer Society groups, but I have tremendous support from my family. I have a son and a daughter. My siblings are from a big family. My cousins, my friends, my nieces, nephews, they support me. I'm a member of Hospital Christian Fellowship, and as I said, they are there for me. Also, I have mentors like the Apostle Duncan, Gemma and Vivian Duncan. Oh my gosh, they speak into my life all the time. So I'm truly grateful to the people who God has put my way. Even the doctors from the Women's Health Clinic where I was first diagnosed, I have an open appointment. I can go to them if I am having a problem, so I feel truly blessed. And, I'm good by God's grace. It's only because of who He is that I am. Now I remember I did my operations. I had bilateral mastectomy. I had my chemotherapy. And as the doctor said, they cannot give me anything else. So I remember I would pray to God and say, God, the doctors may not be able to give me anything else, but you can. So you be my chemotherapy, you be my radiation, and whatever else I need, God, you just come in and be there for me. I am blessed. I am 73 years next month.
Ooh.
And God has kept me. When I think about, oh my God, all what I have been through, I know it is God. And I believe, I am there because of purpose. God, and that's one of the things I tell God. If my purpose on earth is finished, you can take me home. I'm prepared. But if I could still be help to anybody, if I can do anything for the kingdom, leave me right here to finish the work. So my support is tremendous. Tremendous support. And I feel so blessed by what God. It's nothing, because sometimes, people say, if I'm nothing, because I made so many mistakes in my life. But because of who God is, He has kept me. And as I say, when my husband died, it was tough. But because of what God has done, I am able to support people in many different ways because He left me comfortable. Let me put it that way. So what I give anybody to do is not to be a blessing. Why God bless me? He didn't give us things to hoard. No. And this is my understanding of life. You be who God said you should be. Do what God is asking of you. Don't hold back on God. Give. Because God is who gave me life and is giving me life. I don't know how long I have here on earth, but whilst I am on earth, I will be doing exactly what God would have me to do. I feel very privileged to know God is my source. Because I remember one day He was telling me, when I was, saying the doctor this and the doctor, all to you, doctor. You all do a great job. But I was so concerned about my doctor at one time because she was out of the country and the COVID was there. And the Lord told me, I am your source. Your doctor I gave you as a resource. He is going to work things out in accordance with my will for your life. And I say, sorry, doc. Sorry, God. Because, I love my doctors. They have been so good. So I'm always concerned and whatever. And he said, no, I am your source. And your doctor is your resource. And anybody I put in your place, in your path, they are a resource of mine. So I thank God for the understanding, that revelation, to know that without God, I will be nothing, nothing. With
All right,
everything.
awesome. Awesome. I
Amen.
really love your testimony. It's really inspiring, honestly, because what stood out for me, you spoke about the importance of prayer and how your team has helped you. But we often take the time out to pray for the cancer patients. But I think one of the things we need to remember are those persons that are taking care of these patients, like the doctors, the dietitians. I think it
Oh,
is
yeah.
so important to keep them in prayer because I believe it can be a very stressful experience for them as well. Seeing
Yeah.
so many persons in front of them, you don't know if they're going to live or they're going to die. And God has kept you past 70. And I mean, you have a lot to give God glory and thanks for. Not, Dr. Major, I'm going to go back to you before I go to Miss Moit. She spoke a lot about spirituality, and you are a doctor. You have done surgeries, you've seen different patients. How has spirituality kept you after experiencing so many different types of tumors, cancers? How has it helped you?
I would say that seeing all these cancers and things that develop in these individuals, you have to have some form of, or somebody to say lean on, or a higher power to say lean on, because these things don't necessarily discriminate who they happen to. They happen to anybody at any age, and you have to be mindful that you want to continue to pray and pray for these individuals that they may have a good go with it with respect to the operation, with respect to the treatment afterwards. I know prior to going into any procedure, I always say a little prayer just to ask the Lord to guide my hands that, this individual could have the best outcome possible at this time. Because we have your lives in our hands basically, because you give it to us as well as the Lord, because you go to sleep and then you hope that we were able to do what we said we're going to do and bring you through this procedure quite safely. And I would be a fool to say that I do this or it's me that do this or that does this, and not necessarily the good Lord guiding my hands, allowing me to do this and allowing me to have the positive outcomes that happen. Now, not all things, go the way you plan, even though you pray for it, even though you ask the Lord to guide you. Sometimes you do have bad outcomes. And those are the ones that you kind of lose a bit of sleep over. But again, you pray about it and you ask the Lord to kind of guide you through it. And that's why I feel that spirituality for me is quite important, because it keeps me a bit level headed to know that it's not only me that's doing this, because I know a lot of my surgical colleagues can feel almost like a God complex that, yes, I've done this is me, this, and start beating on your chest. But I know that, there's something higher than me that's controlling me and making sure that I do my best for these people.
Dr. Major, your message was so inspiring and impactful, because out of all the medical practitioners that we've had on the show, you're the only one that would have expounded so much on the importance of spirituality. And I just want to encourage those of you who are believers, those of you that are joining us, remember not only the cancer patients in prayer, but also the medical practitioners and the dietitians and all of them that are required to come together to help the cancer patients, because sometimes your prayer can make a difference on the outcome of the operation or the treatment process. So this is very important. Remember them in prayer. I'm going to go back to Miss Moit. We often, well, before I ask you the question on herbs, how important it is for the diet, if it adds value, how has spirituality helped you? Because I believe you would have spoken to cancer patients and other persons about their diet, whether persons are trying to lose weight or just live a more healthy lifestyle. How has it helped you to remain in alignment?
Similar to what doctor said, it helps, in grounding you, starting your day that way, just asking for that cover, for that guidance, for that, discernment in terms of how to handle persons. So it's not even sometimes your knowledge, what you know as as a dietitian, a doctor, you know what you know. But when it comes to individuals, you want to, even though you're imparting this information, you want them to be able to accept it. Sometimes some persons do not accept, certain things that you may say or recommend all at once. They may need additional time, but, as a person, as a professional, you cannot be upset with them. You just have to, people do things in their own time. And so there's no reason to feel like you are a failure. And I think I've been doing this for so many years now that, I am grateful of the gift. I see it as a gift, my profession, because it's a lot of giving back and sharing with those who don't have that knowledge. And I feel blessed that I'm able to do so and do so most times effectively. So I continue to pray for my colleagues and, in similar boats, pray for the patients as well, and clients, because they too need that help with discerning, whatever the information it is that you're trying to impart on them. So faith, yes, is still very, very important.
All right, we have a few questions or comments from the persons on Facebook and YouTube. Falsum is saying, Amen, God is the best source. And then we have Falsum again, want to know if too much calcium in the body is a cause for concern. We also have a comment from Aurelia Casimir, Amen, Doc. And then we have Cordelia, Amen. Prayer is the key. Cordelia is joining us from Dominica. And then we should really pray for them. Yes, it is important to pray for our cancer survivors, medical practitioners, and everyone coming together to assist the cancer patient. The question, want to know if too much calcium in the body is a cause for concern. Doc, I'm not sure if yourself or Miss Moit would like to take this question.
Well, too much calcium can be a cause for concern because it depends on just trying to understand with respect to, is this ingesting too much calcium as a supplement, or is this just you had a routine blood test and you have an elevated calcium level, which is two separate things. So if you're ingesting too much calcium, you run the risk of having kidney stones, joint pains, and other issues. So we want to minimize the amount of calcium that we do ingest, which is in the form of supplements. And if you have a blood test that shows that your calcium levels are elevated, then they may want to check for a hormone level known as parathyroid hormone, because that may also be elevated, and you may have a little adenoma of the parathyroid gland that needs to be removed. So calcium, it depends on what is it exactly, whether it's a blood test or whether it's ingesting. Then you can kind of determine what is the actual cause behind the high level of calcium and whether or not you should be concerned about it.
All right, Dr. Major, last week I had this general surgeon on the show and I forgot to ask her this question, and maybe you will be able to respond to it. After your cancer surgery, what are some of the issues you may experience long after?
So it
Breast
depends on
cancer, for breast
breast. Okay,
cancer.
okay. So
Mhm.
breast. So when we talk about issues, we more or less talk about complications related to the surgery, and we divide complications into immediate and delayed complications. So some of the immediate complications that can occur after breast surgery is bleeding, number one. And if you've had a mastectomy, you can have quite a bit of blood that can collect underneath those skin flaps. And these individuals may need to go back to the operating room to evacuate that blood and look for whatever may be bleeding and stop it. They may even require blood transfusions. The other immediate complication that we kind of worry about is that of pain. So we kind of make sure that they're on adequate analgesics afterwards. And some of the later complications that can occur would be that of infection. So sometimes individuals can have infection developing underneath the flaps. Patients may need to be placed on antibiotics for this, or they may even need to have the flap opened up, irrigated, and drained of all any purulent material that may be present. Um, some of the long-term complications would be that of lymphedema, and that is when we remove the lymph nodes from under the arm. And sometimes individuals who've had extensive lymph nodes removed, they can get swelling of that arm in which the lymph nodes were removed from. And this tends to be permanent. So you'll sometimes notice some women wearing a sleeve that goes from like their wrists all the way up the arm, trying to minimize the amount of edema that's present. And we also tell individuals who have had their lymph nodes removed from the arm, from underneath the arm, that they shouldn't have any blood draws from that arm, as well as you minimize the amount of trauma or injury to that arm, as well as you tell them not to do a blood pressure reading from that arm. You want to use the side in which there has been in which has had no surgery or no lymph node surgery. So those are some of the main long-term effects. Lymphedema may have some infection, um, but those are the main ones related to breast surgery itself.
Now, as we wind down tonight's discussion, I just want to shout out my sponsors, Nagico Insurance, and my partners, Antigua Barbuda Cancer Support Community and Community Charitable Ministries. Thank you so much for partnering with the Apex of Training and Development. And many persons ask, why a training and development organization? Well, there is a correlation between health and wellness and productivity level, and I believe the dietitian can attest to that. And we saw the need to educate the populace on their health, and this is why we decided to partner with these organizations to bring insight to help you to improve your health on a daily basis. Now, as we wind down, I'm going to ask Mrs. Zamore to give her final remarks. What would you like your audience or the audience to take away from tonight's message? What message would you like to leave with our audience?
Okay, I think that everyone should make sure they do their annual checkups. Don't neglect to ensure that you have your checkups. And even if by chance nothing is seen, but you still have some doubt about how, you have what we call the gut feeling, get a second opinion. I think that is important because we never know. So a second opinion could go a long way. And, you know, don't hesitate to ask for help or advice from the right source or from the right people, because you get so much old wife tale about cancer that you can be bombarded. So make sure you get the information from people who are qualified. I can't stress that too much. Make sure people who you ask questions know what they're talking about. Go to the right people.
And
And
one
don't neglect to demand above there. He's the
Amen.
greatest. He's the greatest. Oh, yes.
One thing I can say that has been consistent throughout the program, all of the cancer patients spoke about their faith and the importance of having faith in God, praying. And the patient that we interviewed last week, she said the exact same thing you said. She believed that it happened to her for a reason. She's here for a purpose, and she's
Yep.
going to fulfill that purpose. She said she asked God, it's either you're ready to take me home or you are allowing me to go through this for a purpose.
For a
So
reason. Yep.
always remember that cancer is not a death sentence. And I'm sure Dr. Major and Miss Moy can attest to that. And we're seeing you, Mrs. Zamora, as a living proof that it's not a death sentence. God has
Not
given
a
you
death
three
sentence.
scores and 10. You're 73, and
Yes.
you are a cancer survivor. You have a lot to give God thanks for, and
Hallelujah.
we celebrate the goodness of God with you. I'm so happy that you were able to join us all the way
Thank you.
from Trinidad. It was such a pleasure having you. And before we end, I need you to give us a scripture that we could use, but I'm not going to ask it. No, you can think about it. Let me go to Miss Moit so she could leave us with her final comments before we end this program. Miss Moit, any final remarks from you?
Yes, thank you. Um, just in closing, I wanted to remind persons how important, most of the food groups are in eating a variety of foods. As I said earlier, yes, the protein, the carbohydrates, your fruits and vegetables, your beans, peas, and nuts, and of course, fats and sugars in smaller quantities, because we know those are associated with chronic diseases, hypertension, high cholesterol, diabetes, cancer, and so on. Of course, drinking enough water, keeping yourself hydrated throughout the day, not depending on any one food or any one supplement as a cure all, just using general nutrition, good nutrition throughout. I think I also mentioned going towards more of a plant base. You don't have to become vegan, but using, more plant-based foods in your diet can go a long way as well.
All right. And how much exercise should we be doing a day?
Right. And
Can
with
we walk for 20 minutes and that's it
right.
every day?
So with exercise, I didn't talk much about this, but yes, exercise is like the queen to the diet. Together they make a kingdom. So exercise, it just depends on where you are. I don't expect if you're just starting out, you're going to walk for an hour, but give yourself goals. So if someone is just starting out, probably 15, 20 minutes to begin with, working yourself up to 45 minutes to an hour. I usually recommend at least 3 days per week. So that way persons don't feel pressure that they have to go every day or 5 days. So you pick 3 days that you can go, set a time. Does morning work for you? Does afternoon? And of course, lastly, don't do the same thing all the time. So if you've been walking the regular route at the same pace for the last year, and it worked for you, switch it up, increase the pace, maybe do a different route, maybe add an incline, maybe add some weights. Switch it up so that way your body doesn't get used to it, and you will have some more benefit from that routine.
So would you
Amen.
recommend 6 days a week?
Never. Not even I do. Well, tell you what, if you're doing 6 days a week, definitely not 6 days of the same thing. So let's say, for instance, you do 3 days of cardio, which is maybe you're walking. Some persons may do 2 days of strength training, and probably the last day of flexibility training, something like yoga, may be helpful. So you can split it up that way, but not doing 6 days of the same thing.
Oh, okay.
Yeah.
And so you can do 6 days, but just mix it. Just have a
Right.
mixture.
Right.
All right. Thank you so much, Miss
You're
Moit
welcome.
and Dr. Major, all the way from the Bahamas. Dr. Major, what are some of the services you offer? I know you have your own clinic and you also work with the hospital. How can persons locate you? Can persons outside of the Bahamas visit your clinic?
Yes, they can. They can find me online if they just Google Dr. Don Major. Cancer Surgery Bahamas was my company. And if you go online, you find Cancer Surgery Bahamas, and you'll find me, and you can actually contact us from the number that's there, and we'll be happy to see you. You know,
Are you planning on expanding outside of the Bahamas, Doc?
at some point, yes. Yeah, at
Okay.
some point.
What would you like to leave the audience with this evening?
Well, some of the similar things that have already been said. You know, lifestyle changes. So you want to lead a healthy lifestyle, which includes a healthy diet as well as exercise. Cancer itself is not a death sentence. So there are treatments for these cancerous lesions that people can develop. And what I would not want people to do is be afraid, because I've had patients that, kind of sit at home. Let's say they have this lump in their breast, but they're afraid to go and get it checked out. And they sit at home for months and months and months on end. And by the time they come to see me, it's already ulcerated through the skin. It's bleeding. It's smelling really bad. And at that kind of time, there's really not a lot that can be offered with respect to treatment. So it's important that if you feel any lumps or anything abnormal, you go and you get checked out by your family doctor. As well as it's important that you screen for these things. Like I say, the common things we screen for would be breast cancer, every woman at the age of 40. And this is for what we call average risk women. So the majority of women who don't have a strong family history or who don't have a genetic predisposition, they should get their mammograms at the age of 40. And they can either do it every year, once a year, or they can do it every other year, depending on what their physician feels like when they discuss it with them. And then for colon cancer, you want to get screening at the age of 45 every 10 years in the form of a colonoscopy. And then for prostate, you want to get your PSA levels checked. So get them done early. If it happens, you want to catch it early, and that way we can treat it with just minimal, touch-up surgery kind of thing.
Dr. Major, you have written several articles on cancer that have been published in the Bahamas newspaper. Where can persons read your articles?
I usually publish them with the Nassau Guardian. So if you go online and you Google the Nassau Guardian and you go into the health section, you should have one there. I just recently published one, I think it was last week, basically on what to expect when you're undergoing breast surgery.
All right. So those of you who would like to learn more about different cancers, you could you could Google Nassau Guardian, a newspaper, and Dr. Major, and I'm sure other medical practitioners have contributed to the health section in the Nassau Guardian. Is it a weekly article that is being published from different practitioners?
Well, they have a health section that basically various people publish in. So doctors, you have the nutritionists, you have physiotherapists. So they kind of have a variety of publications. Yeah.
All right, thank you so much. Just a few comments. Cordelia Thomas, great and informative program. We have Imelda Benjamin. She's one of our partners. And for those of you who would like to donate to cancer survivors, you can contact Nurse Benjamin at 1268-722-1019. Again, you can contact her at 1268-722-1019. Nurse Benjamin is doing a remarkable job at the Mount St. John
Amen.
Medical Center, Celeste Bird Medical Center. She has played an instrumental role in assisting cancer patients financially with support. So please, if you're looking for a charity, you want to support persons, there are persons out there in need, you can contact Nurse Benjamin, or you can contact Celeste Bird Medical Center in Antigua, or you can call her at 1268-722-1019. Nurse Benjamin, you're doing an excellent job, and it was indeed a pleasure working along with you. She also commented, thanks to the entire panel, great program. A comment from Falsam Graham, thank you guys. This is so informative right now. I'm a doctor, a dietitian, and everything in the medical field. Love you, miss you, Mrs. Hodge, for not leaving me out. Oh, thank you for not leaving me out. And I look forward to seeing you in our class next week, Tuesday. Bernadette Joseph Ephraim, thanks so much to the Apex of Training and Development and the panel. Food for thought. And I just want to thank everyone for their unwavering support. I want to also take the time out to thank all the businesses across the Caribbean that have supported the Apex of Training and Development programs. Those of you who would have invested in our learning management system, those of you who would have invested in our training programs, thank you so much. We've had persons from as far north as Sabre, Turks and Caicos, as far south as Grenada. Thank you, thank you, thank you. We're not only about training and development, but we're about health and wellness and regional integration. And I thank God for giving me this ministry. I see it as a ministry where we could come together and share and help each other in different areas. A big thank you to my sponsor, Nagico Insurance. Thank you so much for believing in this program. Thank you for supporting it. And I'm looking forward to greater things. Remember, those of you who don't have any insurance, you want to do your screening, but you can't afford it, or you want to do a little operation, visit Nagico Insurance and sign up for one of those medical plans. I'm sure one of the ladies in the Anguilla office or any of the territories that they're located in 21 territories across the region. They'll be more than happy to have you. Renika Isaac, she's saying great job to the panel. We also have a comment, Roberta Ephraim, thanks for these programs. Over the past weeks, I've learned so much and have become more aware of my body. Thanks to all for the information. So thank you guys for being with us over the past week. Roberta, you have been a faithful viewer. And remember to share the information with your friends, your family, even after we've left tonight. I think it is valuable information, and I think it could really help persons to improve their lifestyle. So thank you, thank you, thank you. Thanks again to you, Mrs. Zamore from Trinidad, Miss Moit, and Dr. Ephraim. But I cannot leave until I get my scripture. So take it away, Mrs. Zamore. We want a scripture. What can we leave with?
Amen. Well, even as you asked me, I thought of all things work together for good to them that love the Lord, to them that are called according to purpose. So everything you have to go through, all things work together for good. Once you love God, you're going to be okay.
Thank you so much. And I forgot to thank God. Lord, thank you for this opportunity. And I just want to also thank my husband. He has been such a great support. I thank God for him. He has been such a blessing. My family, my friends, and Miss Francine Joseph James, who brought the idea, who wanted to partner. She's from the Community Charitable Ministry. Again, you can support the ministry. They're doing an excellent work. Contact 1268-722-1019. And for those of you who need treatment, you can visit Dr. Major in the Bahamas. I know it might be a little bit far, but hopefully soon he'll be opening his branches throughout the Caribbean. I've been encouraging him to do so. And also our dietitian, Miss Moit. Miss Moit, where can persons find you? Maybe somebody wants to lose weight and needs some advice. I think I'll be calling you.
No problem. And I do online consults as well. So even though I'm not in your island, I'm still very much available. You can email me at samantha.moit, MOITT, @gmail.com. Or you can find me on Facebook under the same name. There aren't many or any other person by that name, and send me a message and I can share further contact and we can set up an appointment as needed.
Thank you so much. Again, it was a pleasure having every one of you support. This season has been awesome, and I'm looking forward to next season with more sponsors, more practitioners, and hopefully we can have you guys again share some more insight. It was a pleasure being your host on the Apex of Training and Development Cancer Awareness Program in collaboration with Antigua Barbuda, the Cancer Support Community and Community Charitable Ministry. This program was sponsored by Nagico Insurance. And once again, have a wonderful, well, I didn't say have a wonderful, things work together for good to them that love the Lord. Remember that scripture. God bless you. Remember to stay safe. Have a wonderful evening. All the best. Bye-bye.
Thank you. Have a
Thanks,
good
Fran.
evening.
Thanks.
God bless.
Safe. Nice meeting you